Pharmacology, cardiovascular, antithrombolytics. Rivaroxaban, or Xarelto, is a selective 10A inhibitor. Mechanism of action. Rivaroxaban is a selective inhibitor of factor 10A and indirectly inhibits platelet aggregation induced by thrombin. Indication. Rivaroxaban is indicated for prevention or treatment of DVT and PE. In combination with aspirin, it is indicated to reduce the risk of major cardiovascular events, such as cardiovascular death, myocardial infarction, and stroke, and in patients with chronic coronary artery disease, CAD, or peripheral artery disease, PAD. Considerations. For overdose, activated charcoal can be used to reduce absorption, and Andexa is a reversing agent. Avoid in patient with moderate to severe liver impairment. Report any unusual bleeding or bruising. Adverse side effects. Warning. Epidural or spinal hematomas may occur in patients who are anticoagulated with rivaroxaban and are receiving neuroaxial anesthesia or undergoing spinal puncture. These hematomas may result in long-term or permanent paralysis. Risk of bleeding can be fatal. Patient education. Patients should report any signs of unusual bleeding or bruising to the healthcare provider. The patient should also notify the provider of all prescriptions, over-the-counter medications, vitamins, and herbal products. Dabigatran, or Pradaxa, is a direct-acting thrombin inhibitor. Mechanism of action. Dabigatran is a competitive direct thrombin inhibitor because thrombin enables the conversion of fibrinogen into fibrin during the coagulation cascade. Its inhibition prevents the development of a thrombus. Indications. This drug is used to prevent or treat deep vein thrombosis, DVT, or pulmonary emboli, PE. Considerations. In case of overdose, idarucizumab is a specific reversal agent and is available. Safety and effectiveness in pediatric patients have not been established. Adverse effects. Warning. Epidural or spinal hematomas may occur in patients who are anticoagulated with dabigatran and are receiving neuroaxial anesthesia or undergoing spinal puncture. These hematomas may result in long-term or permanent paralysis. Risk of bleeding can be fatal. Patient education. Patients should report any unusual signs of bleeding or bruising to the healthcare provider. Additionally, dabigatran bottles should be disposed of 4 months after opening. The patient should also notify the provider of all prescriptions, over-the-counter medications, vitamins, and herbal products. Antiplatelets. Acetylsalic acid or aspirin and clopidogrel or Plavix are antiplatelet medications. During an active myocardial infarction or heart attack, chewable aspirins are used due to their rapid absorption. Mechanism of action. Aspirin inhibits platelet activation and aggregation. Indications. Aspirin is indicated in patients with established peripheral arterial disease or a history of recent myocardial infarction, MI, or stroke to reduce the rate of MI and stroke. It is also indicated to reduce the rate of myocardial infarction and stroke in patients with ST elevation and non-ST segment elevation, ACS, or acute coronary syndrome. Considerations. It is important to remember that the effects of these medications last the life of the platelet, 7 to 10 days. So aspirin will need to be withheld for several days before surgery or certain procedures to prevent excessive bleeding. In elderly patients, there is an increased risk of bleeding events with concurrent use of clopidogrel plus aspirin. Aspirin is contraindicated in children under the age of 12 with flu-like symptoms due to the risk of Reye's syndrome. Overdose is irreversible. Clopidogrel is metabolized to its active metabolite by CYP2C19. Concomitant use of drugs that inhibit the activity of this enzyme result in reduced plasma concentrations of the active metabolite of clopidogrel and a reduction in platelet inhibition. Adverse effects: increased risk of bleeding. Warning: there is reduced effectiveness for patients referred to as CYP2C19 poor metabolizers. Patient education. Patients should report tinnitus, unusual bleeding of the gums, bruising, or blood in the stool to the healthcare provider immediately. While on antiplatelet therapy, patients should avoid alcohol to prevent gastric irritation. Additionally, patients should avoid NSAIDs while receiving antiplatelet therapy. Alteplase or TPA. Alteplase or TPA is a thrombolytic used to break up clots. It has a very short half-life of 5 minutes, so it can open a clogged artery rapidly. It is also given with heparin to prevent reocclusion of the affected blood vessel. There is also a smaller dosage form that is used to flush clogged IV or arterial lines. Mechanism: Alteplase binds to fibrin in a thrombus and converts the trapped plasminogen to plasmin, thus breaking down the clot. Indications for use: Alteplase is indicated for the acute treatment of myocardial infarction, stroke, or massive pulmonary embolism. It is also used to clear central lines, such as peripherally inserted central line catheter, or PIC. Considerations: the drug is contraindicated in situations in which the risk of significant bleeding is greater than the potential benefit, such as active internal or intracranial bleeding, history of recent stroke, recent or within 3 months of intracranial or intraspinal surgery or serious head trauma, presence of intracranial conditions that may increase the risk of bleeding, some neoplasms, arteriovenous malformations, or aneurysms, current severe uncontrolled hypertension. Significant post-administration monitoring is performed due to the risk of life-threatening bleeding. Adverse side effects: this drug can cause significant, sometimes fatal, internal or external bleeding, especially at arterial or venous puncture sites. Avoid intramuscular injections and perform venipunctures carefully and only as required. It can increase the risk of thromboembolic events in patients with high likelihood of left heart thrombus, such as patients with atrial fibrillation. Patient education: patients must institute bleeding precautions to prevent complications of therapy. Dabigatran. Dabigatran or Pradaxa is a direct-acting thrombin inhibitor. Dabigatran is a competitive direct thrombin inhibitor. Because thrombin enables the conversion of fibrinogen into fibrin during the coagulation cascade, its inhibition prevents the development of a thrombus. Indications: this drug is used to prevent or treat deep vein thrombosis, DVT, or pulmonary emboli, PE. Considerations: in case of overdose, idarucizumab is a specific reversal agent is available. Safety and effectiveness in pediatric patients has not been established. Adverse effects. Warning: epidural or spinal hematomas may occur in patients who are anticoagulated with dabigatran and are receiving neuraxial anesthesia or undergoing spinal puncture. These hematomas may result in long-term or permanent paralysis. Patient education. Patients should report any signs of unusual bleeding or bruising to the healthcare provider. Additionally, dabigatran bottles should be disposed of 4 months after opening. The patient should also notify the provider of all prescriptions, over-the-counter medications, vitamins, and herbal remedies.